Too much facial fat loss can significantly age our faces, so it's important to take caution when selecting anti-aging treatment. Some providers say radiofrequency is a miracle skin tightening treatment, but the million-dollar question is, does radiofrequency cause facial fat loss? This is a question I'm asked constantly. So in today's video, I'm going to teach you everything you need to know about radiofrequency for anti-aging, including whether or not radiofrequency melts facial fat. Stay until the end for a bonus segment where I'll tell you all of the radiofrequency treatments that I do on myself and treatments that I've done in my 20s and 30s leading up to this point. All right, let's get into it. Hi, my beauties. My name is Dr. Stephanie Kappel, and I'm a board-certified fellowship-trained cosmetic dermatologist in Newport Beach, California. Before we get into this video, I want to quickly remind you about my new Ask the Doc email newsletter. You guys have such great questions, but I'm not always able to respond to all of them. So if you want a chance to have your question answered in our Ask the Doc email newsletter, make sure to sign up with the link in the description and leave your question in the comments below with the hashtag AskTheDoc. All right, lesson time. Let's talk about the science of radiofrequency. What is radiofrequency and how does it work? Radiofrequency is just a form of energy that puts heat into the skin very elegantly and very intentionally to stimulate neocollagenesis, which helps lift, tighten, and pull to help treat skin laxity. And we know that skin responds to heat by the stimulation of collagen, which we refer to as neocollagenesis. When you have neocollagenesis, the skin gets plumper, firmer, tighter, and it lifts and pulls up on the skin, bringing it back to where it used to be when we were 20 years younger and had a lot more collagen in our skin, especially in areas where we need a little bit of tightening in the lower face, the under eye area, the under submental chin area, any other area of the face where you're having a little bit of volume loss or a little bit of skin laxity. Radiofrequency is just one form of energy that we can use to improve skin laxity. Other forms of energy include ultrasound, microfocus ultrasound, and microwave technology, but all of these forms of energy have the same common mechanism of action, and that is putting heat in the form of radiofrequency or ultrasound or microwave energy into the skin for the same cause and effect, and that is to stimulate collagen to improve skin texture and skin laxity. Does radiofrequency cause fat loss? So this is the million-dollar question. This is what you see all over social media and all over the internet. Certain people are very adamant about radiofrequency melting fat and decreasing volumes, and certain people are very adamant about not having this be a side effect of radiofrequency. And here's the deal. As with everything, it all depends on the operator and the device. So if you're a plastic surgeon and you have a bunch of extenders in your office and you're buying refurbished machinery and equipment because you don't want to pay full price for the premium software and the premium platform directly from the company, and you're buying your device from a third-party laser or device company or broker because it's $10,000 instead of $300,000, you're going to probably melt fat and decrease volume loss in your patients, especially when you're combining it with an extender who doesn't really understand laser physics and hasn't had the residency and fellowship advanced training to really understand how these machines operate, because you will be increasing side effects and complications just simply by not knowing. And combining that with an old refurbished used platform that you got at a deal, it just is a recipe for disaster. For that instance, yes, it can melt fat and it can cause fat loss. Now, I also want you guys to be smarter. If you're following me and you found my channel, you're smart. I'm non-sponsored. I tell you the truth. I've had 20 years of higher education and experience and training in cosmetic dermatology and laser and device medicine. So I'm going to give it to you straight and I'm going to tell you the truth. The fact that a lot of plastic surgeons will say bad things about radiofrequency or Thermage or Thermatite or RF microneedling is because they want you in the OR. Those guys want to operate on you. They want to do facelifts, neck lifts. I don't care if you're 30 years old or how young you are, they're still going to want to operate on you, and they're going to make their main focus of business getting you into the OR and having you have surgery. Now, for a non-surgical office that wants to do minimally invasive procedures, radiofrequency, whether it's radiofrequency microneedling, which I'm actually not a huge fan of, but radiofrequency with or without microneedling, or radiofrequency energy-based devices like Thermage, or even non-radiofrequency energy-based devices like Ultherapy, Softwave, any modality that's using ultrasound as a form of energy, it can melt fat in the wrong hands with the wrong provider who's not performing the procedure correctly and using an outdated software or platform or refurbished equipment with swapped out parts and things that happen on the outside in this industry. Aesthetics is a highly corrupt industry, which is why I have this YouTube channel. I want to be the source of truth and information and honesty out there to protect you guys from bad things happening. So a non-invasive procedural dermatologist is going to recommend radiofrequency, but then why do the plastic surgeons not recommend it? Again, they want you in the OR, they want you to operate, they want you to do surgery. Or if they're in the OR. They have all their extenders who may be 2 weeks out of nursing school, who don't really understand laser physics. They don't understand how to heat stack and put the vectors and operate these devices, and they think more is more, and if heat increases collagen, let's just crank it up to temperatures that are way too high. They're now decreasing fat stores, and they're melting fat, and they're melting volume, and they're decreasing volume, which is not what you want. Had you done a derm residency and have taken derm boards and have done advanced fellowship training where we get tested and have an intricate knowledge of the way these devices work, that wouldn't happen. But for the most part, unfortunately, most people who are operating a Thermage device don't have this education and background and training. They turn it on, they turn it off, they crank it up, they numb their patients, and they're completely doing a disservice to their patients because they're not stimulating collagen, they're melting fat, and they're getting into higher temperatures, which doesn't necessarily mean better results. It actually means worse results and a higher level of complications. So it's just a mixture of misinformation out there, you guys. So I encourage you, if you're thinking about radio frequency or an energy-based device and you're worried about fat loss, if you go to somebody who is highly trained, and not to their people who they're hiring to run their office while they're in the OR or they're in the Maldives with their wife or whatever they're doing, but if you go to somebody who's highly trained and understands these devices, and you're at an office where they're using an updated platform directly from the company, because when the company comes out with the newest platforms, they will provide it to the doctors and the providers, and when a newer update comes along, they offer that to the providers, and providers like myself always jump on the most innovative technology and the newest platform. But for those shady med spas or plastic surgeons offices who try to want to have a little side hustle and have a bunch of energy-based devices, they're not buying the top of the line directly from the company. Now, some are. I don't want to make that blanket statement, but it's really important to just cite your source, make sure you're going to a device operator who knows what they're doing and they're using the updated platform, because in that case, you're going to get all the benefits of skin tightening from radio frequency, but without the complications of fat loss and volume loss. Also, I want to say that anyone who has gone through appropriate training, especially even through the company, when you buy a device from the company, they have trainers come out to make sure that you're supervised and you're using this equipment correctly. They'll say never numb your patients. If you're having a Thermage treatment and somebody's numbing you, they obviously haven't gone through appropriate training, because you don't want your patient numb. You want that biofeedback, because when you are getting to temperatures that are too hot and it's painful, then you're getting into fat melting territory. So I never numb my patients. If you're a patient of mine, during Thermage, we never use nerve blocks, we never use even numbing cream, because I want that biofeedback from the patients to say, doctor, it's too hot, it's hurting, turn it down. And we never even get to temperatures that high, but would that ever happen, I would definitely turn it down. In addition, the newer platforms will turn off at temperatures that are too high that could get you into trouble and cause complications. So you don't even have to worry about that with the newer platforms. So that's the tea on fat melting with radio frequency. With anything as operator dependent, it depends on the device, and you don't want to be numb for the procedures, because you want to be able to say, dude, that's hurting, turn it down and don't crank it up. Because when your patients are numb and they're just laying there, these people are increasing the temperature, increasing the energy, and they're melting your fat, and they probably would be hurting you if you weren't numb, but you don't have the nerve capability to say, that hurts, turn it down, because you're numb. So never use numbing when you're treating a patient with Thermage. And if you go to an office for Thermage or most of these radio frequency devices and they numb you, just ask why and probably run out the door. So next we're going to talk about radio frequency microneedling. Radio frequency microneedling. Now, I'm not a big microneedling fan, only because I've used them all. Vivace, Infinity, Morpheus 8, Profound, all of them. And either I've seen a lot of side effects from other providers using this in their offices, and then they send the patients to me to reverse these complications when they happen. Or when I use them actually in my office, where I actually did my laser fellowship training back in 2014 through, I think, 2018, we had all these devices and we were super underwhelmed with the responses. People are always like, I'm not sure if this made a difference. It was expensive. It was painful. You never really have happy patients with radiofrequency microneedling, which is the reason why I don't have it in my office. Now, you'll see them a dime a dozen on every street corner and every med spa, because either the providers don't know enough to say that's not going to really give me a big change for my patients. They get sold by the very aggressive reps that come to your office. They buy you lunch, they buy you dinner. They're coming to my office all the time. We have to shoo them away. And they'll get played by these reps. They'll buy the device and then they're like, okay, now I have a radiofrequency microneedling device. What am I going to do? I have to get packages, memberships. I got to get patients in to have this procedure. But honestly, as a provider, I've always been very underwhelmed with the results from radiofrequency microneedling, which is why I'm not a big fan. I also feel that they have a higher risk of melting fat and causing volume loss. I'm not sure if it's because of the mechanism of action and because of the pathophysiologic effects of this device, or if it's just because simply they're usually in med spas with extenders who are not very highly trained. So it's a recipe for disaster. But you know, I'm sure that there are people out there who have had a good experience with radiofrequency microneedling. If you're one of these people, please drop a comment in the comment section and let me know, because I'd love to hear if you guys have had great responses, because 90% of the time patients are unhappy with the results. They said it was a waste of time and money and it was painful for no reason, and they're underwhelmed with the results, or they've had complications, fat loss, thinning of the skin, post-inflammatory hyperpigmentation, pox-like scars, acne-like scars, and even worse. So that's my take on radiofrequency microneedling. But again, don't listen to me. If you're one of these people who have had this procedure and you had a great response, then that may be the choice and device choice for you. But for most people, especially if you're just starting out in aesthetics and you're doing your research and you're deciding which treatment to go, I wouldn't go with an RF microneedling route. Thermage. Okay, Thermage is one of my favorite energy-based devices. And again, I am not sponsored. I'm not in ties with any company. And if one day I decided that I didn't like Thermage because I saw something I didn't like or I wasn't happy with this performance, I would not recommend it anymore. Or if something newer and better came along, a better technology that I liked better than Thermage, I have the freedom to promote, or not promote, but recommend that treatment to my patients. So I love the fact that I'm not sponsored and I can speak freely. And I really do love Thermage because I've been consistently happy with the responses that I get from my patients, from the before and afters. I don't think I've had any patients who have not seen a difference in their faces with respect to facial laxity, texture, lifting, tightening, pulling in it with this procedure. So again, it's very operator dependent. Thermage is an energy-based device that uses heat in the form of radio frequency to stimulate collagen and neocollagenesis from the fibroblasts, which are the collagen producing cells in our skin. So I've personally had Thermage about 4 times. I'm 46 now. I had it starting at 30, I had it at 35, 40, and I had it at 45. And it's probably been one of the best things that I've done for my lower face and neck as well. So again, as with anything, it's very operator dependent. And honestly, when in my office, we follow a different protocol for Thermage. Usually the lower face is the most common area that we get requested for Thermage treatment, and we stack the treatments from the lower face to the upper neck just to really snatch that area. And I feel that sometimes med spas will use the same tip for multiple patients, which I feel is unethical, but they're trying to cut costs and lower overhead. For me, that's not an issue. I'd rather have my patients have an amazing response and beautiful results and be happy with their treatments and gain my trust and come back because they're happy with the treatments, not because they're wrapped into some package. So the way we do Thermage, and I'm not going to give away too many of my secrets because I do feel that medically, legally, I don't want to talk about settings or give medical advice over YouTube, but the way we do it is we just concentrate that treatment area here. Most of the handpieces have different number of pulses. We use a 900 pulse tip and we concentrate those 900 pulses in this area. Of course, you have to be careful with the midline because the thyroid's there. We always avoid that area. And we heat stack those vectors in a certain way that really packs a punch with efficacy. And I feel that sometimes when other offices will do like a brow lift and forehead, and then they do the face, and then they do the full neck, and you're spreading out these 900 pulses too thin, you're not going to get that punch, that pack a punch of efficacy that you will if you just concentrate it in the more problematic area. So people always ask me for my settings. I don't usually get those away. And honestly, I do something different on each individual patient. I customize it for each individual patient. And my laser nurse and the other physician in my office does as well. We do the same, we don't do the same treatment on everyone. And we also use the biofeedback from the patient. Everyone's skin thickness is different. Their depth of penetration of the RF may be different. We call it the impedance is very different. So we're not going to do the same thing on each individual patient. And we're usually constantly adjusting the settings throughout the treatment. It's a very dynamic process. So unless you have an operator who is all in and really in tune with the laser physics, the device physics, and the biochemical reactions that are happening in the skin, you're not going to have the same result. And so I feel like I'm a huge proponent of Thermage, but if you look online and you see mixed reviews, you're going to see mixed reviews because Not everyone's doing it the same. And again, as with everything, it's operator dependent. Thermage versus Ultherapy. So Ultherapy uses microfocus ultrasound as the heat source or energy source in the treatment, and Thermage uses radiofrequency. Both put heat into the skin, which stimulates the fibroblasts, the collagen producing cells, to make collagen. If you look at an extreme case, when you look at like a burn victim, someone who's had a burn, their scars are very plaque-like, keloidal, thick, coated with collagen, and when you look under the microscope you see loads of collagen. So you know that the skin responds to heat by making collagen. In an extreme case, you look at a scar. So if you think of Thermage and Ultherapy, they're both inducing a very controlled and very elegant scar formation. This brings me to my next point. A lot of plastic surgeons will say if you have Thermage and Ultherapy, you're not a candidate for a facelift or a neck lift, and that's simply not true. I can speak on this as a dermatologic surgeon who's fellowship trained in Mohs micrographic surgery, and as a cosmetic dermatologist who uses non-surgical devices and lasers in her office. So when they say that, it's fear mongering. It's surgeons not wanting you to spend your money on Thermage or Ultherapy. They want to get you in the OR and do your facelift or neck lift. And I can tell you, I've done thousands, not hundreds, thousands of flaps and grafts and surgical procedures on patients on their faces who have had Thermage and Ultherapy, and it has never been an issue. So anyone who tells you otherwise has a goal in mind and has an agenda that they want to stick to. So again, just wanted to provide truth and honesty for you guys. And when you're talking about Ultherapy versus Thermage, they both induce a collagen neocollagenesis or collagen synthesis to lift, tighten, and pull and to treat laxity, but through different energy forms. But they basically work the same way. Ultherapy and Softwave both use ultrasound. Ultherapy uses two different layers and depths of the energy delivery system, and Thermage uses radio frequency, just how I described before. But to be honest, I've worked in offices where we have both of those devices in the same room, and time again, patients were much happier with Thermage, happier patients, better results, more reproducible results with Thermage, which is why in my office I have a Thermage and not an Ultherapy. That's not to say that Ultherapy isn't a great device. I just personally don't think it's as good as Thermage. And again, if something better comes along in the next couple years, I'll recommend that one. So I only recommend what I truly feel is best for my patients based on evidence-based medicine, anecdotal data, and what I see every day, seeing hundreds of patients each week in my office. Morpheus 8. So Morpheus 8 has had, I think, over $75 million put into their marketing. So you're going to see Morpheus 8 everywhere. You're going to see it in every Medi Spa. There's even one at my gym where I go to work out. You'll see them at your lash extension studio. They're everywhere. But to be honest, I'm not a huge fan, only because I feel that they get an A+ in marketing, but they get a D- with results. Because most people, I don't have this device, and I never have and I never will, but most of my patients who come to see me for treatments and have had Morpheus 8, I don't think I've maybe had 2 or 3 people out of hundreds that have said they noticed a difference. Again, if you've had a response to Morpheus 8 and you're a proponent of it and you're not sponsored by them and you're not in cahoots with the company, please drop a comment in the comment section and give us your positive feedback if you've had any at all. But for most intents and purposes, most patients don't really have great outcomes with Morpheus 8, and a lot of people say it's a waste of time and money. And I've never been impressed with radiofrequency microneedling, which is why I don't have it in my office. Again, I have nothing bad to say, don't want to hurt anybody's business, but just based on anecdotal data and what is happening in the real world, I have not been impressed with the Morpheus 8, and that's why I don't have one in my office. I never take paid sponsorships, and just know that a lot of people that are promoting Morpheus 8 have other reasons to do so. I'll leave it at that. Profound RF. Okay, so I first used a Profound RF back in 2014, and this was during my laser fellowship training, and I was super excited. It was manufactured and distributed by a laser company called Syneron Candela, which I love. I love this company. They're the ones who make the V-beam. They're the ones who make the PicoWave laser, which is an amazing laser, great company. Not a fan of Profound. I've seen complications with pox-like acne scarring, and the company said, oh, there was a problem with the tips, or they were coated or they weren't coated, or the arc of the radio frequency caused a divot. I don't care what the reason is. I see that more than once, and I'm just turned off from that device. So I'm not a huge fan of Profound, and again, to be honest with you guys, I've seen acne scars. They look like enlarged pores or like pock-like scars sometimes when you can see scarring from this device. I'm sure the technology has been improved over time, and maybe the device is a lot better now, but it just kind of left a bad taste in my mouth, and I'm not a huge proponent of Profound for that reason. Of course, you're a product of your experiences, and I've not had a good experience with Profound, and I've had patients with similar experiences with with scarring from this device, which I've had to use Fraxel, CO2, peels, and a lot of other modalities to correct these scars that were caused by that device, and Morpheus 8 as well. So I'm not a fan. Again, I'm just one person, and again, I'm not sponsored, so this is just my data and truth and my honesty and what I truly believe. And if I'm contradicting another YouTuber who you follow who is recommending this, then just cite your source, and just know that we all have different opinions based on our experiences with these devices. Radio frequency and skin tightening. So as we talked about before, radio frequency can induce collagen and also elastin synthesis as well, which helps tighten, lift, and pull the skin. So usually like lower face, the skin on the neck. If you look at my YouTube videos from before, I was in my 30s and I was haggard and I wasn't up to date with my radio frequency and my Thermage treatments, and I caught up real quick and was able to help rejuvenate my skin, and now that I'm older, I'm more focused on energy-based devices and lasers, whereas in my 30s and even my 20s, I was more into fillers and biostimulatory fillers. But I feel like now that I'm older, radio frequency for skin tightening has been really, really important. The mechanism of action is just inducing collagen neogenesis and elastin synthesis, and those are the two extracellular matrix proteins that give structural support to the skin. And as we age and gain wisdom and have birthdays, and with sun exposure, environmental pollutants, HEV, invisible light coming from our devices, it breaks down and fragments those collagen and elastin fibers so that the skin sags and the pores enlarge and the skin stretches and it falls. And when you increase collagen stores and increase elastin fibers in the synthesis of those extracellular matrix proteins, the opposite is true. The skin gets lifted, it gets tighter, plumper, firmer, smoother. And so that's why radio frequency is used for skin tightening and is one of my favorite treatments for that. I also, spent decades looking at skin under the microscope as a Mohs surgeon, and I would be dumbfounded when I would see these patients who had disfragmented, I'm excising skin cancer, so they obviously have sun damage. The collagen fibers are just like dysmorphic and thin and wispy and just not very strong or thick or plump. And the elastin fibers, it's called solar elastosis. You have these like fragmented elastin fibers. And then after the Mohs surgery and after the skin cancer surgery, they would have, epiphany and say, well, gosh, I got to start taking care of my skin. And they'll start doing Thermage treatments and doing radio frequency treatments and laser resurfacing. And months later, we would do a skin biopsy for something else, and I would compare the two skin biopsies at the histology, looking under the microscope at the skin cells. And I would be astounded when I'd see the thick, beautiful, healthy collagen fibers and the elastin fibers, these beautiful purple elastin fibers. And when you look at skin under the microscope, you can really see the histological changes, and then you correlate that with what you're seeing clinically, like a patient pre and post Thermage or pre and post a Fraxel laser series, and they look beautiful and they look better and their skin looks healthier clinically. But then when you correlate it with looking under the microscope, it's just really, really fascinating. So that's fascinating. So that's why I'm a huge proponent of it, and that's why I love lasers and devices so much. Radio frequency for double chin. So in theory, radio frequency can be used to melt fat and to treat a double chin. However, I have it so ingrained in my brain to not achieve high temperatures with radio frequency to melt fat and to decrease volume that I personally don't use radio frequency to melt fat and to reduce a double chin. In fact, I will usually use Kybella, which is deoxycholic acid, an injectable fat dissolving solution, which gives much better, more predictable and smooth, even results. And because I don't ever want to achieve radio frequency temperatures where you're heating up the skin so much to where you're melting fat. But in theory, yes, it can be used, and I feel like a lot of providers do use that. And that's not to say it's wrong if you do. I just personally don't, because I feel like I have other modalities that are specifically to melt fat. So I use my devices that are engineered to tighten the skin to tighten skin, and I use my devices and procedures that are engineered to reduce fat to reduce fat. So radio frequency combined with skincare. So I engineered my own skincare line, MDR. Of course, I'm a huge proponent of it, and I see all of the corruption of the industry in skincare and aesthetics and dermatology, and I just really had the incentive to make my own products that I knew would have the best vehicle delivery systems, the best, most active ingredients, and the most innovative technology. So of course, skincare is really important, especially combined with radio frequency, because when you do radio frequency or energy-based device treatments for the skin that is going to increase the production of collagen and the synthesis of collagen, you want to give your skin the building blocks to do so, and you want to give them the actives to do so. It's kind of like having a radio frequency or a laser treatment in the office is like going to the gym, and your skincare is going home and eating clean and eating your protein. So if you're going to be upregulating a system in the skin, if you're going to be upregulating signal transduction cascades in the skin to stimulate collagen, you're going to want to give your skin cells the building blocks to make the collagen, and then that together augments your results. So you get a 1 + 1 = 3 situation, and it synergistically gives you better results. So in my MDR products, I would have to say my NMF hydrator, barrier repair, and the vitamin C and the RXR retinol are components and active ingredients in skincare that, one, with effective and elegant vehicle delivery systems, gets delivered to the fibroblasts, and the fibroblasts are stimulated from radio frequency treatments to induce collagen synthesis. I mean, that just knocks it out of the park. You should see my patients. They have amazing results. And when you combine these in-office treatments with skincare, that's just next level results. And you won't understand it or appreciate it until you try it. Radio frequency cautions and treatments I don't recommend. So again, we kind of touched on radio frequency microneedling. I just feel that this is probably, out of all of the RF treatments, the highest risk for melting fat and causing those large pores or indented kind of pox-like acne scars. I'm not a huge fan of it. I'm not a huge fan of going to medi-spas where they're using refurbished devices, where they're using numbing. Okay, so because I can't stop people in the aesthetic industry who are corrupt and not doing things the right way and just taking your money and doing bad things to good people, I can empower you guys. I can't change what they're going to do, but what I can do is give you guys the tools and the information to protect yourselves. So when you go in and you're having a consultation for Thermage, don't be afraid to ask, hey, where did you get your Thermage device? Did you buy it straight from the company? How old is it? How long have you had it? And I had a patient once saying, Dr. Kaplan, I feel so, bad asking my provider that. Don't be afraid. This is your face. This is your money. This is your hard-earned money that you're using. And this is your precious face that you're trusting this person with. If you can't ask that person, where did you get your device? How long have you been doing this? How old is that platform? And where did you get your training? They shouldn't be even allowed to touch your precious face. My patients come in asking me that all the time, and I love it. I absolutely embrace that, and I want everyone to do that. My patients will fly in to see me saying, where are your credentials? Where did you do your derm residency? I had somebody ask me my board score one time, which was amazing because I crushed my boards and I got in the 95th percentile. But I love that my patients ask me that. So don't feel bad, because if you're going to be going to someone who you're trusting with your face and you're giving your hard-earned money, don't be afraid to ask these questions. So I would not recommend having a treatment done at a place where they're going to use numbing, because those people are going to numb you so much that they're going to crank it up to where it hurts, and when it hurts, you're at fat melting temperatures. So that's my rule number one. And then don't be afraid to ask, their level of training and how familiar they are with these devices. If you are a medical student or a fellow dermatologist, I would probably ask you to draw out the signal transduction pathway and write out the theory of selective photothermolysis, or ask them, what are the fat melting temperatures of this device, if you really want to get them on their toes. But for you guys to know also, people ask that a lot because I'm bringing this up and kind of going on a tangent, but when people ask, what are the fat melting temperatures, that's a tricky question, because you have to think that you have the epidermis, the dermis, and then you have the subcutaneous fat. Most of these radio frequency devices have this arc of radio frequency that is going from one part of the electrode to the other, and the depth of penetration can vary depending on the skin thickness, the impedance, the amount of fat, the thickness of the dermis, the thickness of the epidermis. So mostly, for all intents and purposes and for board exams, the fat melting temperature is usually 41 degrees Celsius. But you have to remember that the fat is way down here, and you're usually achieving temperatures anywhere between 46 to maybe 60 degrees Celsius. You want that heat in the dermis, because that's where the fibroblasts are. That's where you want all the collagen synthesis to occur. But even if you're at 60 degrees in the dermis, for that heat to dissipate down into the subcutaneous fat, it's going to be hard to get to 40 degrees down there, even though you would think 50 or 60 degrees is numerically higher, a higher number than 40. It's so far away that it would have to dissipate. So in order to get the fat to be 40 degrees at fat melting temperatures, the collagen stimulating temperatures between 50 and 70 degrees or so would have to be way above that, because it would have to dissipate and make up for that distance that heat has to travel. In addition, you can heat stack to where if you're doing 5 passes and say your first pass there's not much heat, second pass there's not that much heat, but the third pass, the heat from the first and second passes hasn't escaped the skin, it's still in there, and that's called heat stacking. And when you heat stack, then you can achieve those higher temperatures that will A, be painful, and B, can melt fat. So again, Thermage and radio frequency devices should never be painful. When they're painful, you're in fat melting, volume loss danger zones, and you want to stop immediately. So I hope that is useful information to you guys. Radio frequency treatments I do on myself. So as I mentioned earlier in this video, I'm 46 now, and I've been in this industry for a very long time. I think my first laser I ever fired, I snuck out of the first year lecture hall in medical school and was with the derm residents, like doing lasers at the Beckman Laser Institute. I went to the University of California, Irvine School of Medicine for med school, and the first time I ever fired a laser, I think I was only 22 or 23 years old. Anyway, but I've been in this industry a long time, and I had early exposure to a lot of these devices, and I had my first Thermage treatment when I was only 30 years old. Did I need it? No. I was super snatched, super tight along my jawline, but I did it anyway because I wanted a collagen bank and increase collagen stores. So as I lost collagen, each 10% of my collagen each decade, I would stay in one place. So I basically did my first Thermage treatment, which was from my lower face to upper neck when I was 30, and I did it again around 35, and then I had a little lapse. I wanted to do it around 40, but it was almost closer to my 41st birthday, and then I did it again at 45, and I'm now 46, and I really feel like that's one of the best things that I've done long term to collagen bank and increase collagen stores. So as I lost my collagen, or as I'm losing my collagen, I'm kind of staying in the same place, and that's the true meaning of anti-aging. And I remember hearing that in a lecture, and I'm like, I need to do this to myself. And I was thinking in forms of anti-aging, preventative treatments when I was at a young age, because I was getting, these lectures in medical school and my derm residency about how important it is to keep up your collagen stores, because it's inevitable you're going to lose collagen as you get older. So I've done Thermage on my lower face. I actually have done Thermage for like a little brow lift and forehead lift, but I was really, really young at that time. I was like in my mid-20s, and we were more just practicing on each other. I'm sure now that I'm older, it's paid off. But I have done a forehead lift, more so that my co-resident could practice on me. And then I've been really diligent about doing Thermage around my eyes. So I have had an upper eyelid surgery, so I've never had Thermage of my upper eyelids, but I have really been diligent about doing Thermage of my lower eyelids, because I feel like this is one of the most impactful preventative treatments to keeping the under eye area nice and smooth and tight, because you're increasing collagen stores, you're increasing collagen, you're increasing elastin, and this skin under the eye is the thinnest skin on our face, and because of that, it's the first to show our age. So I've been really diligent about Thermage under my eyes, and I probably do it like every 2 to 3 years. So at a higher frequency and a higher pace than I've done Thermage anywhere else. And again, I'm not saying that this is for everyone, and I feel that sometimes when I post the things that I've done earlier in my 20s and 30s that are benefiting me now in my 40s, some people get upset, but you have to remember, you guys, this is my industry. Skin is my career, has been my entire life, and I had early access when I was younger, and half the time I was doing these preventative treatments unintentionally because we were just basically practicing on each other. But then when I learned more about the skin and how to take a preventative approach to it, I was ahead of my time in doing these procedures, because back then nobody really cared about this stuff. I always have, but I feel that I'm in a unique position because I'm a little ahead of my time with the degree of preventative anti-aging treatments I did when I was younger that are now benefiting me in my late 40s in 2023. I hope you guys loved this video, and as always, I'm non-sponsored. Thank you so much for watching this video, and share this video or channel with anyone who would value non-sponsored content from a board-certified dermatologist. I've been in practice almost 20 years now, and I've stayed true to that throughout my entire career, and that is my promise to you. All right, you guys, love you so much. See you next week.